Manuel's phimosis is long gone, but I realized when I was writing the phimosis section to try to explain how we debugged it and what our solution was, that it was probably a little bit confusing. So I decided that we would kind of reenact what we did when we debugged his phimosis. So he no longer has the problem, but we're going to just kind of reenact everything that we did and that we went through. So first he thought it was a fungal infection, didn't really tell me much about it, and treated it with tea tree oil, which didn't really work. By the time I found out about it, he was in a lot of pain. He couldn't retract the foreskin at all. He had a big, thick phimotic ring. We went to 2 of the top urologists in the San Francisco Bay Area, and they both basically said he could try a steroid cream. They said they didn't know why it worked, but sometimes it works. And if the steroid cream didn't work, then they would cut the foreskin, either make slits or circumcise him. They both had different methods that they like to do for cutting. So neither of those sounded very pleasant. And we weren't opposed to the steroid cream, but steroids, are a drug, and we wanted to kind of see, is that really going to help? And they don't really understand why it works, so it didn't really make complete sense to us. So what we did is I looked a little bit online, and I found a study linking phimosis to an infection of Borrelia. And Borrelia we know a lot about. We have all had Lyme in our family. He has Lyme. We knew that. So we figured maybe this is actually Lyme. So I decided to try to test some of the antimicrobials that work well against Lyme. And the ones I tested were ozone. I just have my normal fruit and vegetable ozonator here that I tested. The steroid cream that the doctor gave us. Cowden antimicrobials. These are herbs for Lyme disease. Some of them are to be fair, some of them are antimicrobials and some of them are drainage remedies. But I had picked out the antimicrobials, so I picked out the Banderol, Cemento, Mora, Kumanda, Enula, and Houtonia. Those are the antimicrobials in here. The others are drainage remedies. So I had picked out all the antimicrobials. And we also tested antibiotics. These are amoxicillin and also a sulfa antibiotic. These are commonly used for Lyme as well. So these were the things we tested, and this initially to look at how do we get this infection under control and hopefully get the phimotic ring down a little bit, get him more comfortable, get him out of pain, and all of that. So what I did is I tested his baseline, and I'm going to try to pull his fingers apart, and I'm going to look for how strong are they. Are they stronger than his baseline or weaker than his baseline? Now in this case, because he had phimosis and we were looking at phimosis, I had him with his other hand on his penis. And he's got his pants on, and over the pants is perfectly fine. He's just got his other hand right here over his penis. So his baseline is actually him just kind of holding and focusing on his penis. So I go 1, 2, 3, hold. And he's actually pretty strong. Well, he's not sick. He doesn't have the problem anymore. I would call that, we started ranking the strength on a scale of 1 to 10 to give an idea. So 10 is really strong and 1 is really weak. And I would call that maybe an 8 or something like that. The next thing I did is, so that's his baseline. I have him hold the first thing on his penis. So let's go with the steroid cream. So he just holds it right where he was holding his hand. 1, 2, 3, hold. That's actually, he is actually stronger with the steroid cream. I call that a 9. And then I had him one by one hold all of the antimicrobials there. 1, 2, 3, hold. Actually pretty strong on that, about like baseline, I would say 8. And the next one, 1, 2, 3, hold. That one's actually weaker, number 7, I would say on that one. Okay, so I'm not going to have him go through all of these. We did the same thing with the antibiotic, holding it there, 1, 2, 3, hold. He's actually weak on the antibiotics, interesting. And then I had him hold the ozone. Now, how do you hold the ozone? What I do is I get the end of it, which is stuck here under the table, and I actually turn it on for a minute. And I've got I've got a diffuser on. See, I was washing vegetables this morning, so I have my stone diffuser on it, and I was washing in water, ozonating some water to wash my vegetables with this morning. But what I do is I actually just, you can leave it on, but I like to take it off, just run it for a minute, and then I have to unplug this to get it to turn off, and then I have him hold that on his penis area with some of the ozone kind of still in the pipe. 1, 2, 3, hold. He's actually testing about like baseline. I would call that also maybe an 8 or a 7 on the ozone. But when he had the phimosis, the ozone was testing the best, along with the banderol, which is one of these antimicrobials here. Those were initially testing the best. After a couple of days, the banderol wasn't testing as well, and the inula was testing well, another antimicrobial, so we switched over to that. We know that Lyme can insist, we know it can hide, we know it can change form, we know it can mutate. We also know that it's resistant to most drugs because it does adapt so well. So that was our solution here. I'm not saying that's the solution for everybody. I don't know, but it's an interesting solution, and for us it was preferable to cutting. So that actually worked and got his infection pretty much gone. The redness was gone, the pain was gone, but the skin had changed color, changed back to a normal color, but he still had kind of a tight ring around the penis. So what we did after that was we said, okay, there's some stuff on the internet about stretch the phimotic ring, and we didn't really know, but we had clearly gotten rid of the infection with this solution that we had found. So what we did next was I brought out a bunch of creams that we have. So I brought back the steroid cream, the coconut oil. I've got some aloe vera that I pulled out. I don't think we actually tested that one, but I pulled it out this morning. Jojoba, calendula, castor oil, and there's a list on the website of all the oils and creams that we tested. And the idea was to give some elasticity to the skin with maybe some creams and see if that would help with some stretching exercises. So what I did again to test these was I had him hold them on his penis area, again with his pants on, just like we did with the antimicrobials. 1, 2, 3, hold. He's actually really strong in the calendula. I think that was his solution that worked the best for him when he had the phimosis, was actually the calendula. So when I just tested him now, he's probably a 10 or 9 or 10 on the calendula, so still testing well on that one. But I basically went through all of these creams with him to find the best one. In our case, it was calendula. Is it always a calendula? Who knows? Is it always ozone and banderol and inula? Who knows? We don't know. But we wanted to put this out there as what we found worked, and for us it was an alternative to surgery, which was preferable. And I also wanted to mention how, when he was testing well on the ozone, how did he actually apply this, is the question. So what we did is we had a Ziploc bag, and we turned the ozonator on, and I took the diffuser off, and I put one end of the tube in the Ziploc bag, and you can zip it up, and the other end we cut a hole and the penis went in that end. You could also probably, any way you can get sort of a bag with the penis in it and the ozonator end in it is probably fine. The idea is to concentrate the ozone around the penis so the ozone is actually able to kill the infection. So you could zip the penis in up here, you could zip the penis in up here and put this on the bottom, however you want to do it. And I think when he was doing it, I originally had some rubber bands and all this to help close the end. I think at the end he just kind of sat there and kind of held everything in and held everything together at the end, but that was our solution. I've seen other practitioners do this for knees or ankles or toes or skin areas. They'll tend to bag the area and then put the ozone in the bagged area and try and keep it closed so the ozone can get to the area. So that's what we did to apply the ozone in the case of his phimosis.